Prevention Commission. And a reminder for all those who are doing it, the HUD lead hazard control grants are due June 14th. We're hopeful that we'll be seeing those out of Prince George's County and the state of Maryland in doing that. It's also the first day of National Healthy Homes Month. So I want to thank everybody who is working to improve the health of housing. And later you'll hear some activities that are happening this month. But two things that I'll say that I know GHHI is doing that people may want to pay attention to. We'll send out the dates. We are doing two national, one on the intersection of climate and health and housing and the opportunities in Maryland and around the country for the dollars that are coming. But the second is the intersection of healthy housing and mental health. And I'm really happy that we are doing this work. So toward the end of the last week of the month, we'll be doing a national webinar with some pretty renowned folks on the issue of emotional mental health and housing. I hope you'll tune into that. So first I'm going to open with yeah.
Could you send Wendy the link so that she can send them around?
Yeah, we'll do that.
Thank you.
That will happen. But I do want to issue a bit of an apology. I should have caught this on the agenda. I made a decision not to invite the secretary for this month, but instead to do it for October after having discussions with HUD and thinking about Healthy Homes Month. So it's on me for the Marcia Fudge, Jake Day. We are going to issue an invitation for Jake Day to join us in September. Hopefully he'll be able to do that. And for Marcia Fudge to join us during October, which is the month we celebrate or lift up lead awareness throughout the country. So we are going to shorten today's meeting a bit. Also to let you know that we do not meet in July and August. We are going to be trying to pull 2 or 3 committee meetings together in the July and August months and I'm going to ask to do a planning meeting with the MDE staff over that time about how we will approach the commission moving forward. And also to say, I know we're going to talk about membership on the commission, but the governor's office has given us a green light on a parent who has shown interest in joining the commission. Barbara and I are going to follow up and make sure that the application gets in, and we'll be able to announce that, I think, shortly. We also have on the phone Nicole Hart from the Baltimore City Department of Housing and Community Development. And Nicole has been nominated and has submitted her application to the governor to take the place of Mary Beth Haller in representing local government. I know Nicole as one of the best public servants that exist and working on the lead healthy housing work for the city of Baltimore. And I couldn't be more thrilled to have Nicole join with her great integrity and public service. And welcome, Nicole, and thank you to Mary Beth Haller, who has now become the acting health commissioner for Baltimore City for about the 2nd or 3rd time. She stands in the breach, and I want to congratulate her and thank her for her work. That said, Wendy, I guess we want to take up the minutes, or I guess first 2 introductions of the commission members who are in attendance. So we'll start in the room first. Those who are commission members, please introduce yourself. Cliff.
Clifford Mitchell, Maryland Department of Health.
Barbara.
Barbara Moore, pediatric nurse practitioner, director of the lead program at Mount Washington Pediatric Hospital.
Okay, Paula.
Paula Montgomery, Maryland Department of the Environment.
Great. Adam, you want to start us on the line? Those on the line, and nice blue shirt there, although it's Duke blue, so I have problems with that.
My apologies. I am a Maryland fan, but what can you do? Adam Skolnick with the Maryland Multi-Housing Association, commission member.
Great. Angela?
Good morning, Mangela Paul from Office of Child Care, Maryland State Department of Education.
Fantastic. Anna?
Hi, Anna Davis, Commission member.
Great. Jacob?
Good morning, Jacob Benzakan, Commission member and owner of JVZ Management.
And Paul Rogers is presenting today, so he dressed up with a bow tie here.
Oh, nice.
Yep, I represent the Maryland chapter of American Academy of Pediatrics. I'm a neurodevelopmental pediatrician, currently happily retired.
There you go. Sue Kleinhammer, I think, is on the line.
Sue, are you there? She's not muted.
Okay. She was there. And Christina?
Christina's muted. Star
I'm
six.
sorry.
Yeah.
Yeah, that's Susan. I unmuted. Sue Kleinhammer, Lead Tech Services, Commission member. Thank you.
And Chris Push, Executive Director, Maryland State Child Care Association, Commission member.
Okay. Do we have anybody else that I don't see?
Paul, Angela, I think we covered everybody.
All right. Thank you all. All right. So if we go to the approval of the minutes, May 4th, 2023, anybody got any notes, omissions, additions? All right. I want to thank the MDE staff who did such a great set of presentations last month as well. Do I have a motion to adopt the minutes?
Moved.
Second. Great. All in favor?
Aye.
Aye. Great. All opposed? Come on, somebody.
Aye.
Okay. All right, then. Hearing no objections, we have adopted the minutes. I think we are going to table any discussion, if it's okay with folks, on any scheduling, since we're going to have the next 2 months to do planning, and then we'll come back in September. I've been calling other commissions to see how they are handling this and looking at to make sure we have the content and the planning done. So as I said, we're going to use the next 2 months to do that, and it'll be a chance to get to know the MDE staff as well. And I will certainly invite all commission members who want to join those conversations on the planning for how we advance the commission in the fall and into the next year. Wendy, you had commission membership updates and renewals due in September.
Yeah, I'm going to share my screen real quick. Present. Okay. Lead commission. Okay, give me 1 second. A tab. I think this. There we go. Okay, I got it. I'm just pulling up real quick. So since we're breaking over the summer, well, for 2 months, we'll be back reconvening in September. Can you see the screen?
Not really. Can you just tell us what's in yellow?
Oh, yeah. So 1, 2, 3, 4, 5. We have 5 members. The term end date is September 30th. So I'm asking that you guys please over the summer. So it's Jack Daniels, Benita Cooper, Jacob Benzakan, Barbara Moore, and Anna Davis. If all of you can please resubmit the application to the governor's office. I can send you guys the link so that you'll have that, and then just get that process started so that we can make sure you're reappointed in September. October.
And if you don't intend to do it, let Wendy know.
Yeah.
As soon as possible. We welcome you all back, but if you're not going to do it, let us know so that we can be working over the summer to get the right folks in place. And Wendy, I think, shared this, but on behalf of the commission, we send our condolences to Jack Daniels, who lost his mother. And that's why he's not in attendance today. And so if you'll keep Jack and his family in your thoughts, we would appreciate that as well. And for those, Wendy, what openings do we have that we are asking commission members to help us find?
All right, so the openings we have, representative of owners of rental property built after 1949, and representative of a child health or use advocacy group. And then
Okay.
that third one was the parent of a lead poisoned child.
Got it. Okay, fantastic. And we will work on those and try to do that as part of the summer too. I'm gonna actually, Colleen Duvall will reach out to every member of the commission. I'd like to just have a conversation on what you think we should be doing or how we should be doing that, so we can make sure that we're moving forward. Your thoughts, and MDE staff, if you want to join those, you're welcome to do that as well. All right, Paul, you are up to talk about the ECO program, outcomes, quality improvement data presentation.
Yeah, certainly appreciate getting the chance to chat with everybody. And what I want to talk about is the ECHO project that we just, in the process of completing now. And this was a grant we received from the American Academy of Pediatrics to our chapter here in Maryland. And Ruth Ann, thanks for your help and support too in the letter and getting the grant too. That was very helpful. What is the ECHO project? The ECHO project is, can we show the slides?
Do you want me to pull it up for you, Paul?
Yes.
Okay, let me go ahead and do that. I'll share my screen.
Yeah, good.
Yep,
The
give
ECHO
me 1
project
minute.
is explained actually in the first slide. So I thought we'd start with the slides.
All right, let me present the entire screen. There we go. Should be up 1 second.
That's got it. Good. Thank you. So
Just let me know when to click through.
Yes, I will. Good. Thank you very much. So what exactly is an ECHO project? The ECHO stands for Extension for Community Healthcare Outcomes. And can we have the next slide? This was a project through the American Academy of Pediatrics. They got a grant from the CDC to fund these projects, and they have funded up to date over 822 projects in 32 countries around the world. And what they've tried to do with these projects is to employ a telementoring program. That is, we used virtual Zooming process to reach out to community of learners across the state. And what they do is bring together the experts with the healthcare providers in discussions of cases, as well as discussion and some general knowledge and background. And the approach is, the idea, the hope is that it's an all teach and all learn. We learn from each other, and we certainly did. That was been certainly our experience. Let's go to the next slide. So how does one create a community of learners? What did we do to create this community of learners in Maryland? We first started out with 16 practices that we invited to join with us. And these 16 practices came from all across the state of Maryland. And what we would do is in each session, we had 6 sessions altogether, which lasted an hour, that we used Zoom process. And during the sessions, we spent 20 minutes on didactic lecturing about lead poisoning. And then we spent another 20 minutes discussing quality improvement processes. What can we do to improve the process in the office? And then we would lead into a case discussion that was submitted by some of the practices, an actual case that they had. The faculty included me and Dr. Mike Iganowski, and Dr. Troy Jacobs was our quality improvement person. And we were very fortunate to have some adjunct faculty. Dr. Cliff Mitchell was very helpful, and appreciate his input. And also Dr. Voss Victoria also helped present, was extremely helpful to our presentations, and all well received. So those are what we did in terms of developing partnerships. And the second thing was develop best practices. What can pediatricians do? How can they improve their monitoring and following children with lead poisoning? We do this by collecting data, and after each session, the participants submitted information on 20 of the patients, and that we collected this over the period of 8 months. And finally, we're able to provide CME. we could provide continuing medical education as well as MOC credits. MOC is maintenance of accreditation credits. We're able to provide those too. Next slide, please. So what did we learn from this community of learners? What did we learn working with these practices over the last couple months? One of the things we learned was that nearly all the practices were not aware of the services that were available through the health departments. And we really kind of have helped open their eyes to what's available and service available. Some of the practices keep telling us they had trouble tracking patients. They lost track of them, or they moved away, and became aware of what some of the things the health department could help. Some of the practices started using and prompting their EMRs, electronic medical records, to do testing. They learned how they could prompt testing for lead poisoning. We also saw that they were helped by getting access to the environmental assessments. I was able to obtain a couple of those assessments and gave those and presented them during the clinical discussion. So they found that was very helpful in managing their patients overall. We found that discussing the submitted cases was really kind of a high point. When we discussed the submitted cases, it really drew the pediatricians in. They became very interactive. We often have offline telephone discussions with them about their cases. And it was a really important teaching point. We also saw point of care testing increased. Two of the practices implemented point of care testing with the lead care during our project. And finally, we were able to identify some of the tools and practices that helped track patients. Next slide. What did we learn from these community learners about quality improvement? We had collected data at each cycle. That is, each session we collected data from all the practices and then monitored that, and saw over the period of time, we saw some improvement in the knowledge of pediatricians in understanding lead poisoning. We saw improved documentation. We saw improved screening. We also saw that there was more consistent follow through after the screening as well. We saw improved tracking of patients and able to document as well, improved outreach and referral of patients in these practices. Next slide. We saw some problems in some of the practices. Some of the practices were hospital-based or a part of a larger institution, and they found lack of support in developing the processes and resources necessary. We also saw that during our sessions, which were held at noon, our sessions went from 12 to 1 o'clock during kind of a lunch break. But several times the pediatricians had to leave during the session because of patient care activities. As I mentioned, some of the practices were having lack of funds to adequately treat and monitor and track these patients. And we saw some difficulties with the quality improvement process. There's quite a bit of hands-on to work with the practitioners on collecting data and doing the improvement process. Next slide. So what can we learn as a commission, which is really a community of learners as well? What can this community of learners learn from the pediatric practices, community learners that we worked with? First, we saw a need that kept vocalizing a need to have reports for them that summarize the health department evaluations and environmental investigations. They thought that would be very helpful for them in monitoring and managing the patients. What we learned as the presenters was the didactic sessions were very helpful, but the case discussions was really the most important thing that drew in and helped create a really learning environment. It was very interactive, very interactive. We learned from that. 2 or 3 of the practices were looking and knowing if there are any sources of funding. Is there any way they can access some funds to help them hire staff and purchase the resources necessary? And finally, we discussed some ways to report the findings that we had on best practices across the state. What we have initially done, as I said, we're still in the process of going through our data, but initially what we've done, we've put all of our lectures and best practice findings on our website so they can be accessed too. That's it. Questions?
So Paul, this is, I think, just, first of all, your work is always so great and I really appreciate it. One thing I've been thinking about practices around the state is how well they are actually connected to community resources. And how we're getting the doctors' practices, right, in the work they're doing, also connected. And so I'm hopeful that maybe not directly related to this, but it inspired me to think about, at one point in time, I think even before Cliff Mitchell was on the scene for this, we did a connection with every single pediatric and family care practice in the state of Maryland and linked them directly in their area to resources for families and trainings on, what MDE's program is, what MDH's program, and all of this, to linking to the care and the quality of work being done in the practice. And I just want to say that I'd like to work with you to maybe do that again now, 30 years later, as we start to get to the last vestiges of this problem, right? And how we link that. So I know it's not directly related to what you presented, but it made me think about how do we link the quality of care externally to the quality of care that's happening. But Cliff, I'll start with you. Do you have questions for Paul?
I don't actually have questions for Paul. I think that the challenge for quality improvement projects is how well they stick over time. And so really the big question about this is going to be not what happens at the end of this, but what happens in 6 months and a year, and whether or not there's a thought about going back to the practices to see whether or not the lessons stuck.
That's a very interesting point. What are our responsibilities after our grant runs out? What happens after our grant runs out? I know formally I would certainly like to follow up on that. And I think that's an excellent suggestion. I don't think that would be too difficult to do, actually. And we probably have some resources we can use within the Maryland chapter to facilitate doing that. So I think that's an excellent idea. And I will take it back to our group and see if we can go back 6 months from now and just do a short query and see how much of it stuck.
Yeah, and I guess what we need to support, right, in that, I mean.
I personally would support it, and if there's a way I can assist.
But I mean, what kind of resources would be needed to do that?
Really just
Survey.
strong will.
Persistence.
Okay, stick-to-itiveness, right?
And a certain annoying repetitive reminder.
That sounds like you.
Exactly.
Wait, oh wait.
That would be great.
Wait.
So I think I'm hearing robocalling. Is it robocalling that you're?
I'm just going to stop at this point.
Okay, great.
No, don't stop. No, thank you, Cliff. I really appreciate that. Now I will see how far we can go through the MDAAP, see how far with our support we have, administrators and so on, is what we could do, and get back to you if we need some a jump start or some help.
Wonderful. And anybody else for Paul?
Yes, ma'am. This is Barb. Excellent presentation. It's a great program. I'm really happy you were able to get started with this 16 practices. Hopefully we can figure out, I don't know if you have a breakdown of like kind of where those practices were, but I was happy to see that you mentioned the environmental assessments and that they found that barrier, not having them available, because that's something that we've identified in clinic as well. In our small subcommittee, we addressed how to make those assessments, environmental investigations available to either the primary, also to our clinic, because we're doing the follow-up with the patient, the family, and we need to reinforce whatever the health department or MDE has told them. So it's really important for us to have that information.
Have you thought about us using sort of a community health worker model, at least to do the visual inspections, that maybe as a part of the follow-up, and that's a home visiting possibility to
For us
Yeah.
to do the home visit.
I mean, or for us to establish a
Oh.
program. You know, we're gonna be starting doing, post remediation work for, the city, right? After they do work, we're going in and doing a lot of, post remediation education, quality control, quality assurance work. I think Catherine, Taylor's on the line here, but I've been thinking a lot about how do we use various home visiting ways to get people into houses as part of that follow-up reiterative work. And what we could, I mean, there's opportunities for lots of different ways to have money right now, right? So GHHI is going to be going after a $50 million Thriving Communities grant from EPA with Children's Hospital and others for Region 3. If we win it, we're going to be able to give up to $350,000 to community organizations to build programs and build capacity. One of the things I'm really interested in is this environmental kind of assessment, visual home visiting follow-up on teaching people environmental hygiene, right, of the way that we can do things and support programs. But I think it's really important, right, to build on that. We can send inspectors out, we can do work, but there's follow-up work that needs to be done with the families, and we don't fund that enough. And so we're going after this grant in one way, try to build that kind of capacity of groups to do it. But I didn't know if there would be interest if we tried to build that, right?
I mean, let me know. Yeah,
Because I think, but throughout the state too, where we don't have environmental assessment being done as well, at least something to get in people's homes and help them think about it, right?
Right. And then the whole idea of being able to get that assessment report so that we know what to reinforce with the family. Because they're coming to, like, for at least our clinic, they're coming every month initially and then decreasing. But if we don't have a report in hand, we're telling them the same thing over and over again. It might not even be what the area of their home that was the issue, or it might not even be their current house that's the issue.
Yeah, I think it's a big area, and especially in counties that don't do their own assessment, it's up to you guys. And you're not going to be proactive enough to do it. Manjula, do you had your hand up, ma'am?
Yes, ma'am. Thank you, Dr. Rogers. And you are the voice of our lead commission promoting the information to the pediatric providers directly. So really appreciate you for taking this lead. And though it's 16 practice providers, it's really great. It's a small start, but hopefully we'll be able to support you. We have with Dr. Mitchell and the commission to help you for continuing the funding. My question is, and like Barbara asked, like, do we know where these practices are, like whether it's city or counties, and also whether they shared any challenges from the parent perspective for not able to do the 2 testing at 12 months and 24 months, and what barriers and what support do they need to improve the compliance for testing?
Yeah, thank you for the questions there. I don't have in front of me the exact breakdown, but we had 2 practices in Western Maryland. We had 1 practice in the Eastern Shore. We had 1 from the city. I think 1 or 2 from the city and several from the county too. So we had a pretty good representation across Maryland. And they do share some problems. The more rural counties don't have as many resources as they do in the city for tracking and helping the families with children with lead poisoning too. I don't know in terms of grant money or what we could do to help resources. I don't know where that would come from, but several mentioned they really need more for money help support more than anything else to help get those resources that they need.
Do you think we could do sort of a projection, get together and try to figure out what that real need or opportunity is? Because if we can figure that out and know the cost, then we can find how to go get that funded. So Paul and Angela and Barbara might maybe work on this, and if we can project what a need is and describe that, we have lots of opportunity to go get the money for it. Without having to go to a state budget to get it.
No, that's fantastic. I will go back and see if I can capture that data. I'm not sure how detailed data. I don't think we really got detailed data on terms of finances, other than saying they needed money for resources as well as a hire of somebody to work in the office to do the screening and monitoring too. So let me go back and do a little more research on that. And I certainly would like to come back and discuss that, see if I can put some metrics into this, as well as come up with some financials. That would be, I think, great. Something I could work with other folks on the commission. That'd be great. As I said, let me start first by trying to get a little more specifics on that.
All right, Paul, my team is going to reach out to you maybe for times, and then whoever can join, we can try to do that. I'd love to do a pilot of it at least and see what that would bear and see if we can't look at this, right?
Oh, that'd be great. I'd be happy to work with that. That'd be a big help.
So much of the EJ money coming out right now from EPA is defined around health, housing, and equity, and I think would fit in this, right? And see how and whether the team with Howard University and GHHI wins that EPA grant process or not, somebody's going to win it for the region, and there would be money out of that I think would be really attainable to start seeing in the fall, because they're going to move this stuff pretty quickly. And I think it's something we ought to be thinking about planning for. And if this is an idea that we think could strengthen some of this work, let's go after it. Right?
That sounds like a good idea. I certainly be willing to help.
Yeah, it'd be fun to do something good and right, not have to get it out of the state budget to do it. Right? So, anybody else have questions for Paul? Going once, going twice. Paul, as always, we love you. We honor you. Thank you so much.
Thank you all.
Cliff, I'm going to talk to you just to give a recap of the Asthma Summit. You were the master of ceremonies and quite good at it. And you were able to be there the full day. Do you want to just let people know what happened there on that? And Chevelle, I think, is on the line too, and Candace. So I know we've got asthma and lead, which I'm going to talk about the lead forum for October. We want to do similarly, but go ahead. Cliff, let you kick it off.
Let me just do this. Okay, I've killed all of the echoes. So I put myself on screen because I'll probably, Wendy, by the way, I lied. I do have slides.
Cliff.
Just saying.
Oh, yeah, sorry. We have your report from the counties too. Sorry, I missed that, Cliff.
Cliff, are you able to log in to present?
I've already logged in.
Okay,
Cliff,
sounds great.
My bad eyes went straight over that. I apologize. Why don't you do that first? We'll come back to the other. My apologies, folks. All the text is going together for me.
No, not to worry.
We have a report from counties on the success of case management efforts.
Yeah, and I noticed Will Doyle is on from Howard County Health Department. Are there any other county representatives on from departments? All right. So what I'm going to share is just some feedback that we've received from the approximately $380,000 or so that we've put out to local health departments to support case management activities through funding from the Association of State and Territorial Health Officials. I'll just remind everybody, this was one-time funding that ASTO made available to us under a cooperative agreement that they have with the CDC. They made that award to 3 states, us, Arkansas, and one of the Dakotas. And we used that funding. Most of that funding has gone out to the local health departments to help support case management activities. So what I wanted to do was share with you some of the experience of the local health departments. Will, do you mind if I share your feedback as well, and then you can comment on it? Is that okay?
Yeah, that's perfectly fine. Thanks for checking, Dr. Mitchell.
Yep, nope, that's great. Almost sometimes, I occasionally, rarely ask people permission before outing them. Wendy, that's not going to be reflected in the notes, I trust.
Sure. You're fine.
All right, so let me just go back up to the top here. And now I'm just going to do this. So I just want to give you all a sense of what the local health departments are actually doing these days. So these are the jurisdictions that received supplemental funding through ASTO, through us. And this is to give you a sense. We haven't heard from Allegheny County yet. So these are preliminary data. You'll notice the big DAFT sign. This is reflecting my mental state when I put this together. So it said DAFT, but we will make the final version of this available to the commission, if that's okay, Madam Chair.
Of course.
Once it's done.
I like anything named Daft.
Exactly. Well, you know, this, as I said, this just really reflects me. So this is a sense of how much activity there is. And I think it's really interesting to note, particularly people think about the number of new cases that occur in any one segment of time. But it's really important to remember that local health departments continue to follow these cases, in some cases for quite a long time. Will, can you just give us a sense?
I'm surprised at the number in Howard County.
So Will, can you give us a sense of how many cases you are, what your longest case is that you're following? How many years?
Resettlement.
Yeah, off the top of my head, I think that we probably have a few cases that first came to us maybe around 2018, 2019. There have been a number of instances where we've seen an elevated level, a downward trend, even to the point of a negative test below what was previously the threshold of 5, and then a rebound due to another exposure that happened after the first source had been identified. So a big part of what we've been doing with this funding that Dr. Mitchell helped us program has been to do a lot more outreach to those cases that maybe saw an initial follow-up test trending downward, but we need to see further confirmation farther out in time that it truly has gone down and can be considered a negative case.
Well, sources on your cases, given they're Howard County, I'm hearing that some of it has to do with resettlement communities, but what are you finding in those cases?
I would say there are two main groups. The first one would be, especially around Ellicott City, some older construction. And so families, especially with a lot of DIY projects that people took up during the pandemic when we didn't have anything else we could do, that seems to have exposed some lead material to kids in those households. So that's one. I would say also one of the things that we love about Howard County is our diversity. And so we've seen among certain communities, and in some cases, newly arrived refugees and others, families that have come from South Asia, or now that the pandemic has eased from an acute phase and people are resuming international travel, families who have gone overseas, some cases have traveled to Nepal, India, Mexico. Those are the other cause that I would attribute to some of these cases.
So put one thing in your hat there. You know, I'm thinking about stuff we're doing during Healthy Homes Month and we during just in general. I'd love to host with the Howard County Health Department maybe a community meeting on people who are doing renovation repair themselves on safe ways to do that. Maybe we could do that in Ellicott City, given that you see that problem happening too, because we do need to get to homeowners. But that's good to know. Cliff, in these other counties, are we seeing sort of this, is it mainly housing or do you know?
So I would go back and I would also turn to Fred and Dr. Boss Victoria and Shamola Dai. I think if you think back to the source identification that was done a couple of years ago by MDE, that we saw that clear division between older, if you look at kids who are residing in areas where they were previously, more than half of the kids identified were in areas that were previously in targeted testing areas. So that what we traditionally thought, that's still overwhelmingly lead paint, lead dust, still overwhelmingly. But when you go and then you look at the segment of newer housing, non-targeted testing areas, which would include the I-95 corridor and other areas in some areas of the other areas of the state, it's a much more diffuse picture. So there is still some lead paint, lead dust, but there's also a lot of spice, food, a lot of less travel, but there is travel. And then more diverse sources, toys, other things. The other thing to note is, and Fred, I might ask you more recently whether or not the trend has continued, that as you get to lower levels, the chances of having a source not identified continues to increase.
Yeah, well, at the lower levels, we haven't begun going out yet. We have done some preliminary looks at the data, and it does look like at the lower levels, travels to relatives, daycare, outside of those areas that you talked about previously, Dr. Mitchell, are included in picking up some of those spurious kind of sources. So,
yeah. So, and I think we'll continue to see that trend. That's quite likely.
Lots of unable to determine
Yep.
the lots.
Even in the 5 to 9 range,
Yes,
there's a lot of
significant.
unable to determine, or multiple sources.
Yes, yeah, you're right.
We've also had the issue that they go into the home and the family says, oh, you don't need to check that area. It's by what areas the family claims the child goes to. And then they come into clinic or to a visit and it's like, nothing's been identified. And I'll go through detail. Where does the child play? Ask 1,000,001 questions. And they're like, well, yeah, occasionally they go to the basement, and that had not been tested.
Yep.
So
We are
transparency from the parent, unfortunately, is a problem.
Yeah. And we're dealing with multiple issues now in homes where there are multiple diffuse sources. And as we start to look at other potential sources for kids with lower levels or persistent exposures, soil outside of the home is clearly one being tracked back into the home. That is something that we're looking at. And I would have to say, despite the focus on water, I don't think we've seen a lot of cases where water has been identified in the home as a source.
No.
But how often is water being tested?
Water being tested more than it has been in the past.
Okay.
And it's still, I would say, not the most likely to appear on any list.
Okay. So we're not getting the reports.
In public, system.
In public systems, right?
Yeah, I
Yeah,
mean,
yeah.
public systems, despite Washington DC, Montgomery County area where there was a problem with the Washington DC public water system.
Yeah.
But the issues we have with water are, if we do have them, are on private well system where
Yeah.
there's a failure at the distribution area.
And that's where we're finding lead.
No, we haven't seen that, because Cliff has hinted on this a lot. A lot of the people have, when they have private wells, they have filters. They don't drink tap water.
So what you're saying is that there might be potential for problems in the source water, but once it gets to like the point of use, there is no longer a issue.
Right,
Okay.
right. Yeah, I mean, that is,
Yeah, lead in drinking water, I think, it's clearly an issue when you talk about Flint, Michigan. There are very specific issues that happened there.
Well, those were completely man-made.
Which were
Right.
and that was part of my point, is that those were the result of multiple screw-ups at multiple levels and multiple decisions by operators, systems, governments, et cetera, et cetera. I mean, I think that what we haven't seen so far, despite looking at a number of instances, is we haven't seen a case yet that I'm aware of. Fred, correct me if I'm wrong, but I don't think we've seen a case yet where water is the primary source of lead exposure in an investigation.
Yeah, that's correct. And I just wanted to piggyback on something that you guys mentioned as far as soil is a blind spot for us right now, because at this point we can't enforce soil. So we really, I think the last couple of cases that we had with some extremely high levels, I'm thinking about the one in Gaithersburg that we were just working on. That's an issue for us, I think, on the policy end. We're going to have to try to make some changes on what we can do as far as enforcing property owners to do something about lead in the soil. So it gets tracked in the house, it gets on the toys, it gets on, some of the, unfortunately, our property owners tell us, just keep the kids inside. And that's just unacceptable.
Well, I gotta tell you, Fred, and Manjul, I see your hand. If you give me 1 sec here. 2 things, Fred. One, I want to connect you with Rupali Datta, who's at the Michigan Technical College, part of the University of Michigan. She was at the University of Texas. She's doing sort of the foremost studies on soil for the Healthy Homes Tech Studies for HUD. We do a lot of work with her in areas around the country. Chevelle has done some work with her, helping to get the communities to do sampling, but would be helpful to have that a study done in Maryland to help support you on anything you need to do. But the other thing I want to raise is there is this, there are issues like the incinerator in South Baltimore that's dumping out a lot of lead out of that incinerator into communities like Cherry Hill, Westport, et cetera. And that's clearly getting in soil. It's clearly getting in tracking. And the one thing I'm always, if you see something like that, I'm not saying there shouldn't be responsibility and liability and different things where there should be. But if you're a property owner and that's getting dumped on you from an incinerator, we have to really figure out who's responsible for the cleanup of that. And something we should talk about, because that incinerator issue is getting bigger and bigger and bigger in Baltimore, where the city had the opportunity to shut it down and they re-signed a lease on it, and it's got lots of issues. So, and I'm sure that will eventually end up over at MDE. Manjula first, then Adam.
Thank you, Ms. Ruthen. While we are listening to these comments about the possible exposures, I'm just wondering about the lead inspectors. Are they been updated on the recent content of what are the possible sources of lead? when the families hire them to go do the lead inspection, do they cover all those possible exposures?
Okay, Paula.
The families do not have, they don't have enough knowledge of where the lead may be present. And it should be the responsibility of the lead inspectors to test entire area, including the basements and the soil. So I'm just wondering, I did take the lead training, the 3-day training, and it was intensive. But again, like as we get more information about the possible exposures, possible sources, and whether they do the risk assessment before they actually test take the samples for testing, including soil and the testing the basement, all of that. So I'm just wondering, when was the training content updated, and whether there is a requirement for the lead inspectors to take retraining or updated training when they do the recertification.
Yes, ma'am. Let me go first to Paula and then ask Chris and Susan if they want to weigh in on that. And then Adam, I know your hand is up.
So in order to perform an environmental investigation by regulation, the inspector is required prior to testing anything to do and when I say comprehensive, it's like 5 pages, 6 pages, that they have to sit down with the parent or guardian and go through, and that determines what is tested. And it's not limited to just lead-based paint sources. There's everything: toys, spices, soil hazards, water hazards. They ask if there was renovations. I mean, it's very comprehensive, and they are required to be recertified every 2 years. But I can tell you that there is nothing more comprehensive than the questionnaire and the inspection. And the fact that they do them so often, you become a little more knowledgeable about what the potential sources are. So if you walk into an older house, I mean, it could be the house, but you don't want to just assume that it's the older house. So Mangela, I hope that answers your question.
Yes, Paula, thank you. But thing is, it's not the children who are already having the elevated blood level, their homes being tested. Like for childcare licensing, we want the houses to be licensed, to be tested before they get the license. So when the lead inspectors go to their houses, regardless of whether there's a child or not, whether there is a child with elevated blood lead level, do they use the comprehensive tool to assess? And also, they should not be excluding the areas such as basement or bedrooms, thinking that, oh, children are not going to be there, or assuming that there's not going to be lead.
Well, your regulations that you have define what has to be tested, correct? So if you want a comprehensive inspection in daycare centers, regardless if they're a rental property or not, I think, we need to take a look at your regulations for family daycares and see, because right now I think they just say if there's defective paint, then you have to do a comprehensive risk assessment by a private third-party contractor. Now, if you want more preventative measures in all properties, regardless if it's a rental or not, you have to do that, I think, by reg. So, I'd be more than happy to do a subcommittee where your attorneys, if they're willing, can possibly meet with our attorneys, because we helped you guys write those regs a long time ago. So they do need to be.
Let's name this subcommittee, because for Wendy's notes and mine.
Let's call it child daycare regulation review.
And let's add funding review to that. You guys are on it. That's great. Adam, and then Cliff.
Yeah, I mean, I think it's this goes back to what we've been talking about for years, which is, if there's a soil problem. I mean, one of the questions I guess I have for Fred is the example in Gaithersburg, was that a rental property or not? And the invariable problems are that we're doing a pretty darn good job in this state of regulating the rental property environment, but we're not doing a particularly good job of helping owner-occupied housing. And then things like soil, rental or not rental, how do you handle that? And we have an affordable housing dearth as is. So then all of a sudden, if you look at rental housing providers, and by the way, I'm not suggesting they shouldn't be they should be a part of the solution. They have to be. But now are you digging up soil at apartment communities or in rental housing? And how are you eliminating lead hazards in that soil? And and Ruth Ann, to your point, I mean, whether it's the incinerator now or whether it's all the lead, fueled cars for all those years until, that lead didn't just dissipate, it went into the atmosphere and then ended up in the ground. And we're going to end up seeing more and more of that. So, how as a commission and how as a state can we handle that without just burdening rental property owners? I mean, and listen, thank God the Cliffs, that if water is not a big source, that's amazing. I mean, that's great to hear.
Well, I
And
mean, yeah. I mean, I got to tell you, this has been an interesting thing in this country, right? We just put $15 billion into the remediation of lead in water when a very small minority of cases across the country come from lead in water. And 84% of the problem still comes from lead-based paint in most states across the country. And we didn't put dollars into that when we could have helped on housing condition writ large in this country and supported an assessment. I want to go back though, Adam, and just say to Fred and everybody on this, years ago, there was a massive lead study done. It was Boston, Cincinnati, and Baltimore. And basically from that, and a woman by the name of Susan Gayo, who used to be at MDE, helped to head this study. And it basically said to Baltimore, you don't have a lead and soil problem. And so from there, we didn't really do much moving forward. The couple of studies done since then, which for Polydata was involved in at least one of them, did not show lead and soil problems in Baltimore, but they have been done in other regions of the state.
Right.
And in Garrett County, you have coal mining and other things, right, that are contributing to soil issues. I think we will find across the state soil less prevalent in this issue, but it's something I think we should do a refresh look at and should look at the past history to where we are now. But I agree with Adam on, how we approach homeowners and rental property owners and where this lies. Dr. Mitchell.
Thank you. So just a couple of points. So if you look at lead in soil over the entire country, the vast majority of lead in soil came from tetraethyl lead that was used in gasoline. And is associated with deposition that's close to transportation corridors because that's where the lead went. And the other problem with lead in soil, though, and Fred, I think you alluded to this, is we've seen some of the cases of lead in soil that we've seen in homes has been because of deteriorating paint. And it's in a corridor right around the periphery of the home. That's a very different situation than the one, and that may be where you've got a problem where you've got deteriorating lead at the source of the home, which is from the lead paint, but it's contaminated the soil and it's just right outside the drip line or right inside the drip line. So I think it's important just to understand where the lead may have come from. And I, that goes, I think, to the point about not seeing it widely distributed in the environment generally. But where it is, it's typically historically associated with tetraethyl lead. So, my other point, I've just totally lost. And it wasn't that important anyway, but I do have another slide.
Oh my God,
Could I-
you're still
could I-
doing a presentation? I totally forgot.
Hold on, Susan.
Thank you, Ruth Ann. From a private risk assessor perspective, this public health problem of lead poisoning is no different than any other public health issue. It's the lack of money. I mean, you ask for an extensive risk assessment to done per regulation in a private house. They don't want to spend that money that it would cost to do so. I can't tell you how many times private owner occupants have been told by me about what it would entail and the cost, and they're just turned off by it. Because to do it per the regulations, it's 3/4 of a day, if not a day, to do that risk assessment.
Right.
Yeah. Oh,
Okay, Barbara.
Susan,
Dr. Moore, I was about to call you. How about that?
No,
No, nurses don't want to be doctors. Sorry.
the nurse practitioner, right?
Nurse practitioners don't want to be doctors.
Susan, I do have a question. Do you mind telling us about what that cost would be?
Well, it certainly does depend upon the size of the house,
Right.
where the house is
The range.
located, the age of the house. All those variables go into it. But on average, after knowing how that and the environmental costs associated, the hard costs associated with dust, soil, water testing, all of those things, it could be $1,000, if not more.
Yeah.
Chris, you agree with that?
I do. Yeah. And to Mangela's point, yeah. And also to reiterate what Susan just said, we experience the same way. It's often that when we're going out to do testing for any variety of clients, they all have different needs and wants. And it's not that we're always going out to do a full risk assessment, that we would be looking at things as we would if we were doing a complete environmental investigation for an elevated blood lead level.
Can I ask a follow-up question to the Maryland Department of the Environment? Is that if there is not an elevated blood lead level and you're just doing a risk assessment, are you by regulation required to continue to follow the same protocols as if there was an elevated blood lead level?
Yes.
I think so. Yeah.
I believe so. So the point of the matter is risk assessments are not being done by the people who actually tend to do them, once again, because of that money factor.
Next slide. Thank you.
okay. And my other point, sorry, coming back to this, and Mangela, just a note, we're really going to do a subcommittee on
Childcare regulation.
childcare regulations. Mangela, just for you to consider, and this is sort of a Healthy Homes, what ATSDR and various other folks are doing now is looking more comprehensively at what ought to be part of that sort of inspection / pre-clearance of homes. You might not want to look just at the lead part of that. You might want to take another fresh look at sort of safety overall and update some of the things that Laura Allen at the University of Maryland has been doing.
Does that include like injury prevention and other things?
Wait, I mean, is she doing sort of behind the scenes?
Yeah, so there's a whole sort of safe, healthy daycare movement that's childcare movement going on. ATSDR has been doing it, and there's been an initiative, and so we might want to consider. It was more for Mangela to think about whether or not she wants to do that in the context of this re-examination of lead testing.
Would she be worth having to be one of our people in the fall?
Well, she is a member of the Children's Environmental Health and Protection Advisory Council, and so she's talked about this extensively at our CPAC.
Well, I will say to my MDE friends here, it does seem to me that we need to just reassess the assessment, process. I'm always curious too, where you need money and do you have enough always to do you know, as we're moving forward on lower levels and that sort of thing. I know you got a little bit of a bump, I think, right?
Didn't
But
get anything.
you didn't get anything.
No.
Why did I think you got a bump on the assessment side?
To quadruple our work.
Well, okay.
Well, happy
we
to talk
need-
about that then.
Yeah, but we need to be planning for the budget this fall and
We are.
those sorts of
Yeah.
things, right? And I think having the commission behind that and the like right to do that. But it seems to me that is also a separate important conversation to think about how the commission can be helpful in that come fall. So maybe this summer, that's something we really focus on as well. We have a new slide.
Oh, wait, what? Who's presenting?
You.
Oh, I am. All right.
Yeah.
So this is from an Eastern Shore county. I'm not going to out
I
them.
created that pamphlet.
Yes, you did.
I am so proud of myself.
And this is just a little update from a shore county, which says we're currently running an outreach ad on the shore,
Nice.
focusing on advertising the new 3.5 guidance and importance of testing. And it purchased some outreach items. This was because this is funding that is not restricted and not state funding. And they were able to actually get some promotional items, and they've been doing kids expos and various other things.
Nice.
Yes, this is what happens. I mean, Dan, I think this goes to your question about what happens when the local health departments have
Money.
some resources.
Yeah.
This is another jurisdiction. We're finding there's a delay between the time that an elevated lead level is reported to the medical provider in the health department and the time the child's primary residence receives an environmental inspection per the Department of the Environment. This was not meant to be a ding.
Yeah.
This is the report from the local health
Yeah.
department. And also finding, thank you, Form 4620, the lead certificate is confusing to some providers since the at-risk zip codes are listed. By the way, I've taken those off and we're getting ready to release the new version of that without the at-risk zip codes. We've reached out to our local public schools. We've discovered that 37% of students entering the public school system have a lead certificate signed by a medical provider, but it's missing the lab values for 12 months and or 24 months. And they also interestingly had 20 parents who signed a religious exemption, and they are doing outreach to medical providers. So this is just to give you a flavor.
Hang tight. So, right, our goal is 100% of those students
Yep.
have this certificate.
Yep.
Is this, do we think that it's only 37.5 because these students were tested before the universal blood lead testing went into effect? Or it's simply our lack of testing?
No, this is 37.5% entering the public school system have a lead certificate signed by the medical provider that is missing the
Oh,
lab.
that is
values
missing. Okay.
For 12 or
Okay.
20
That's not saying only
Yeah, yeah.
37%
Yep.
had.
Yeah.
Do you know how many?
Oh, no. I have no idea. We have no idea in the schools how many kids actually have lead certificates.
Can we?
We, with Herculean monumental efforts, might get a very incomplete, inadequate picture of that. I can't, Alicia Mizzou and I have talked about this before, but for a whole bunch of reasons, it's very difficult to get information out of the.
Well, this is useful information about the labs though, right? And the
Yeah.
providers.
Yeah.
So what's the action? Are you going to take that back to AAP? And
I
labs?
have a whole bunch of things that I am planning,
Okay.
which at some point, it's a secret plan now, but I will disclose it at some point.
Starting to sound like Donald Trump, right? The secret plan. So we're not going to have the.
No, that was Richard Nixon.
Okay, Richard Nixon, sorry.
So when
maybe
they
same.
see that, do they then send them back to the pediatrician to get?
I'm certain they don't.
What?
I think it's,
At 12 and 12.
I think it's I think it would be very unusual. Remember, the whole point of the lead certificate really is to allow the schools to be able to make IEPs for kids who need them. And it is not meant, although it is in the regs that they have to have them in order to start school, schools do not keep kids from attending on the basis of not having a form. And nor would we want them to, frankly. What we are trying to do, and I am investigating, is ways of simplifying this process, both for the pediatricians and for the parents. And I'm looking at ways of doing that, which are analogous to thinking about the immunization record or the asthma action plan. I'm trying to figure out ways of building this into systems
Yes.
rather than requiring the parents to go back actively and get them. But there are all kinds of obstacles to that, including the fact many schools don't have access to CRISP. Many schools don't have access to electronic health records. The health suites, if they're controlled by the school system, are impossible to get information out of, even because of FERPA. And so school health is a conundrum, as you can appreciate, which is a unique beast unto itself, and almost requires an entire separate, it's got an entire separate unit now for that purpose.
Can I just make a comment? Because I'm ignorant to the whole school. Why wouldn't the certificates be housed within, under CRISP or immunization, and then the school accesses them?
So
Common sense.
Well, so there is actually now within Immunet, because of work we did back in 2015, you can actually get lead levels out of the Immunet.
Well, that makes sense.
Which,
so that's great.
And it was within statute authorized specifically to do that. The people who wrote the lead statute cleverly allowed for the possibility of including lead in Immunet. The problem is that while we allow, the regs actually say, if you have access to Immunet, you don't need a Form 46.
Okay.
So, but it's up to the schools to do that and enable it. And that's a school policy question.
Amazing. All right, good suggestion. Go ahead.
No, I mean, it would be interesting because I am on the Child Care Advisory Council. I mean, just maybe like Mangela, Christina, maybe throw that out there and just say what would be the.
Well, you're doing the subcommittee on childcare. Great. To that, let's get some action and whatever this commission could compel others to do. That'd be great. Wendy, does anyone else have their hands up? And I know there's some things in the chat that we can't see.
Can you hear me all right?
Yeah.
Okay, so there's no hands up, but Mangela commented, Paula, could you please send me the flyer and the link so that we can promote? Thanks, Mangela.
Oh, okay.
Yeah, Wendy, let's send that out to everyone.
I will.
Obviously. And do that. Okay.
All right. I'm almost done. So
a few words on this slide and just from a.
Yeah, no, but this is Talbot County. I'm outing Talbot County because I forgot to take away their thing. But the resources allowed them to spend extra time making more frequent home visits, spend time with clients, gathering information, and to do a lot more in-person stuff. And to do more. And one of the things the funding was intended to do was to allow them to go out to deal with those lower level lead cases, which previously they'd really been unable to do because they don't have none of these jurisdictions has a person funded for lead under state funding. They are all cobbling together funding either using Title V funds that were for other purposes. We can't say that legally, but I think Title V funding that they decided to use for lead, or they've allocated either county funds or some other funds for those purposes. And then finally, this is, Will, this is your moment to shine. Do you just want to talk a little bit about what you're doing there?
Sure, tough to outshine you, Dr. Mitchell, but no, this captures some of what we're doing in Howard County. Where, like I said, we have some of those backlogged cases where we saw an initial decline, but not a second confirmation test showing that levels had returned below the threshold. And we just got back from our printing vendor materials in multiple languages on the threat of lead in spices, which is one of those causes that we've seen among the South Asian community here in Howard County. We have in Urdu, Hindi, Bengali, a number of languages that we've used in speaking with these clients with interpretation. just to be able to share that as a common source of exposure. And we have a staff who's been able to dedicate part of her time to these lead cleaning kits to help with some of those families who have some of the dust that's been kicked up from recent renovations or for other reasons.
So, and Will, you know, the next question out of some commissioner, and I'll just say this in advance, is we'd love to see those.
Absolutely, yeah. Wendy, should I send that to you, both the English and all of the translations that we have for those brochures?
Yes.
Yeah, that's fine.
That'd be great. That's a yes.
Excellent, will do.
Yeah.
You know, I knew there was a good purpose for Howard County, right? There you go.
I'm just saying, they do great stuff. And so one last slide. This is from Carroll County, signed by Dr. Wack, who is the deputy health officer. And he sent a letter to all the pediatricians in the jurisdiction. And they did a survey looking at awareness of the new 3.5, need for testing, and so forth. So this funding really has gone a long way in the
And it
absence
was
of.
from Asto?
It was from Asto. Yep.
Fantastic.
Yeah. So I really.
And it's so heartening to see Carroll County, Howard County.
Yeah.
Right, that this is, right?
Yeah. I mean, I think that, one of the things about this is it shows, first of all, just how much talent there is and commitment in the local health departments. And also how much work goes on. There's a huge amount of communication that goes on between MDE, MDH, and the local health departments on all of these that's sort of totally invisible, except it's all time.
Right.
It's a huge amount of time.
Daily, hourly.
Yeah. Well, let me also say that it's the first time I've seen on a letter, the big scan me thing for context. The world is changing.
Yeah.
All right. Do you have another slide?
I have a 2-hour presentation now.
Okay, great. And we are moving on. Any other questions for Cliff? All right, sounds good. Candace and Chevelle, I think you're on. Do you want to just give a brief recap of the asthma summit? I know this is the lead commission, but we have at the intersection of asthma. I just wanted to, I'm going to highlight some funding that I want to make sure people know is there, but did we want to give a brief super recap on that asthma summit for folks?
So I don't know, who do you want to do?
You are Chevelle or Candace. So.
Well, I can start, but they did all the work. So I really just want to acknowledge, first of all, we had a fantastic summit on asthma on May 18th. And I think that the salience for this group and the commission is we, in that meeting, really were looking at all aspects of asthma, from the home to clinical care to prevention to use of the asthma action plan. We had how many people attendees in person? 60, 80?
We had like 50 to 60 in person and another 50, 60 on the line. So
yeah,
20.
And
I think Candace, are we right?
Yes, we had about 65 in person and 50 online.
Okay.
Yeah.
All right. Yep.
Thank you, Chevelle, and thanks, Candace. I think that the big takeaways, first of all, we have, as a result of this meeting, we've been starting to revise our asthma action plan, and a lot of the same comments here about the forms are going in that, which is we're trying to make them simpler for parents and have them be useful for parents, and also reinforce the importance of healthcare provider coordination with health departments around issues of prevention. I mean, I think that the big takeaway from this as well was looking at the social determinants of health, looking where asthma is, looking who's affected by asthma. This goes back to the question of the built environment, the conditions under which people are living. And just as nobody should get lead poisoning in this state, in this day and age, nobody should be having asthma out of control. And that's basically the message.
Yeah, and to that end, I think what we did with the Asthma Summit, we used to run these public led forums and we had very good attendance in years past. And so I'm working with my team to make sure that in October, which is the Lead Awareness Month, that we run at least 4 of these across the state so that people are connected to resources. They understand what it means to have an assessment and understand where to get the monies needed. And Will, I do want to follow up with you too, because I do think in places like Ellicott City and the older communities and counties across the state, we need to be reaching out to homeowners, the DIY groups, et cetera. And we can do a lot of training with the folks we have to tell people how to be safe and do this. Because the last thing people renovating their homes for new kids, having young children, they renovate their house and then they poison their own kids. It's about the worst thing you can imagine. So I'd love to do that. But I think we had great people participating in that. And I think practitioners got a lot of good information. I just want to say again to the jurisdictions, I hope the state of Maryland is going to apply because the lead hazard control funding that is available comes with money to do asthma reduction simultaneously. So I think we should all be supporting the State Department of Housing and Community Development. But counties across the state, there's capacity building grants out of HUD right now. There's money for older adults. There's money to align weatherization and lead programs. And there is the traditional lead monies. We have about $600 million coming out of HUD. I don't know if Stephanie is still on the line here, our Baltimore field director, but HUD has so many resources on the street that we really need to encourage counties. And I don't know if MDE is dealing much with Kent County, but my understanding is that they had shown some interest at HUD to do that. And I'd love to give them some encouragement to apply for monies here in looking at that. And the healthy homes component in any of these counties, they can use for soil remediation, they can use for indoor air quality, they can use for other things that are around environmental health in the housing environment. So just want to make sure that we are pushing that through, and GHHI will help people look at if the submissions over the next couple of weeks, just that give sort of an overview, kind of pre-scoring or anything like that. So if you all know of people doing that, and I'm concerned with potentially Jack being out. If the Department of Housing and Community Development needs help to get that over the line, let's see what we can do to do that, because they can get pretty significant money. Nicole, do you want to give or Catherine, a recap of where you all are on the lead monies in the city and how we're moving that forward?
Good morning. Thank you for the opportunity to let me speak. So in Baltimore City, we have 2 HUD grants totaling about $13 million. Right now, as of yesterday, we have about 212 houses in the pipeline that we're trying to get from the beginning of the process to the end. So we are actually reaching out to the Judy centers. We have some outreach going on actually today. And so basically every opportunity, DHCD is using every opportunity to promote our lead work. So when we have our neighborhood sub cabinets, we actually have one later tonight. We'll be doing the outreach and all of that for all of our lead programs. So we are trying to reach the communities in multiple different ways. We have a number of neighborhood organizations that we are partnering with to attend their community festival. So if you ever get anybody from within the Baltimore city limits that would like outreach, we're tag teaming. We're tag teaming with our weatherization, our lead, and then our overall suite of products, just to bring them into the community. I'm not sure if you wanted any more actual details.
No, I just wanted to make sure that people know that there is significant money in the city. And I was thinking about Paul and all the different practices, making sure that the doctor's practices are proactively connected there, so that my job is that Barbara Moore doesn't have to see any kids, right? And try to get there.
I do want to retire eventually.
Yeah, you get retired, going to have that problem. So, and the city wants to spend their money. They're trying to get the money out.
Absolutely. So we have the 13 million in the lead funds, then we have the extra million, that's the weatherization lead demo. And then we have 4 million from ARPA to add on for healthy homes. So anything that it would previously stop a project for us, we're leveraging that ARPA money to be able to move those cases forward. So we're even looking to bring back old cases.
Yeah, I mean, I just want to say that ARPA money gives the city the flexibility to look at the other health-based housing. Nicole, tell me if I'm wrong, but those gaps that exist in housing, whether it be injury prevention, indoor air quality, a leaky roof, needing broken stair treads, those things that keep houses from getting work done, that ARPA money is allowing us to kind of demonstrate some good connections there. But some of it, I hope, in decarbonization there, Nicole, I think would be great. Well, wonderful. I think we did the legislative impacts last time, and Adam and Anna, unless you have anything new, I think we went over legislation last meeting. Okay, so hot topics, MDE.
Sure. I think that a lot of you know or might have seen the press release of the suit against TTI Power Inc. for the incident that occurred where there was the power washing that spread lead paint chips across a neighborhood in Baltimore. So the suit is against TTI as well as their consultant that they hired, who was an unaccredited contractor. So that suit is moving forward. I mean, that's justice that needed to be brought. Looking at enforcement across, lead program, the agency as a whole, and so expect more coming out of us.
I have a question.
Of course.
Have any of the television stations who fund that, have they covered this?
Not at all. When we found the incident about a year ago, maybe a little over a year ago, we were shocked at the lack of press given how large of a problem it was. There were a couple news sources that had reported on it, but none of those, such as WBAL, who.
Well, I talked to Tim Tootin and tried to get him to do the story, and I just never saw the story come out, and I was just wondering.
I monitored. None of them ever said anything about themselves.
Interesting.
Shocked. Yeah.
Yeah. Yep.
Okay.
Maybe Fox will do it.
Well, if they're not a funder of this is WMAR, WBAL,
and
WJZ, I think, in this, in the tower together. And how are you going about it? Is it particulate? What's the basis of the suit? Is it the particulate that you're using? Is it community health nuisance? What's the?
Yep. So it would be the particulate. There's about 9 different claims that are outlined in the complaint. I can make sure that you have that. Somebody might know better than me here, but on top of particulate, it's the lack of containment. It's the unaccredited contractor. It's the storage of the particulates that were collected because it's a controlled hazardous substance.
Yeah.
There's quite a few different claims.
So there's a new reporter at BAL who's doing all sorts of lead and water. We ought to push on him to do the story on the tower, because they need to do a public service to the people around there. And they ought to participate in sort of the cleanup pieces of that. So let's talk about that. But good work. And I know Delegate Rosenberg is interested in what he can do to strengthen legislation. He's reached out to us on that. So if you haven't talked to Sandy, it's his district.
Yeah, I talked to him quite a bit. I haven't talked to him since the complaint was filed, and so I'll follow up with him.
Yeah, I mean, he's not only that, but he's a good lawyer.
Oh, yeah.
Cliff, any more slides, MDH?
You don't want me to do my 2 hours?
Not today.
Okay, no, that's fine. I think, we are, the only thing I will say is that we are working with MDE on a bunch of issues related to putting lead data up at a census tract level in our public portal. So you'll be able to look at lead levels, lead testing rates across the state by census tract. And we anticipate that that build or release will occur sometime in probably July, August.
Okay, great. Thank you so much. And if you remind us, we'll get that during our summer hiatus,
Yep.
right, Al?
Yep.
Wendy, if you'll help take note and keep us on that. Paul, do you have other things from the provider community?
No, I think I covered it all. Thank you all for your attention.
No, we appreciate it. Angela, anything else you want to bring up?
No, ma'am. Thank
Okay.
you.
Benita, are you on? I think she's not here today.
Hello.
Oh, yes, is she there? Is she there?
I don't know if you said, this is Christina Push, Maryland Child Care. So I'm sorry, I didn't want to slow the flow, but I wanted to make sure that I am on the committee, subcommittee related to regulations in childcare and unfunded mandates and such that you were talking about earlier. So
that's Paula.
Yes.
So Christina's
Christina.
got,
Gotcha.
Paula's got you.
So Wendy.
Baltimore City Housing, Catherine, we're skipping, I don't think, is anybody here from state DHCD today? Okay. Catherine, anything else from the Department of Housing or Nicole?
Hey, Ruth Ann. I did want to add on, basically is the same as Nicole stated, of where we are. We did recently receive a list from the health department of elevated blood level children in Baltimore City. We're expected to receive a full list covering for 5 years. So we actually are going to be making a move on all those families to try to get some work done.
Well, count on GHHI to help you in any way possible on that outreach, and others. I'm happy to map that out if need be. Catherine, just curious about how many families were referred over. Do you know?
The first list was about 300.
Wow.
Yeah, a lot. And we're expecting definitely double the amount as the lists keep coming.
Yeah, let's have a plan of meeting each of those families where they are, for sure, and getting on that. But thank you, and thanks to the health department for that. I know Camille's on off on travel, right?
Yeah,
But-
she's on vacation.
Well, I wasn't going to out her entirely on that because I sent her a text and said that she didn't tell Cliff and I, and so we were brokenhearted to find out she wasn't good. She was on vacation. All right, Wes Chabelle, GHHI for Healthy Housing Month.
Sure. Let me give you a quick rundown of very robust month for healthy homes around lead.
And by the way, does anybody else agree that Wes should be in the broadcasting world with that voice coming across?
Yeah, he does. I agree.
And I just want to tell everybody, when he was first an employee at GHHI, we made him pose as the father of Derek the dinosaur on an animated PowerPoint, and he did really well, and he did not take that career path. Instead, he did lawyer stuff. So anyhow, go ahead, Wes.
Yeah, still fulfilling work here.
Thanks, George.
So Ruth Ann mentioned 2 webinars. We're going to get this out to Wendy. It'll go out to the whole commission. But Ruth Ann mentioned 2 webinars, one on climate and healthy homes, one on healthy homes and mental health, which impacts clients and families. But in looking at some of the larger events around the state, we have Power in the Park in Montgomery County, Tacoma Park tonight, with energy efficiency, lead, and healthy homes together. We have a property owner training on, lead contractor training on the 14th, a property owner training on the 20th. For Juneteenth, we have a lead outreach event in Laurel. We have AFRAM Juneteenth celebration at Druid Hill Park in Baltimore, a very large event there. We also have 3 Baltimore County Library events the last week of June, getting that information out to those areas. And then we also have a number of other community events throughout the month. So really a lot of activities. We'd love to have any commissioners join. If there's specific information you want on an event, please reach out to us or Chevelle or Alexia on our outreach team, and they can, give you an idea, logistics on any of those events, but we'll get that full list out to you.
Thank you.
All right, we're going to circulate that. We always need volunteers at these events. If anybody is interested in volunteering and helping to get out to the community. GHHI will be closed on June 19th in celebration of Juneteenth, but we'll be out in the field with these events. So appreciate our staff who is showing up and doing that work on that day.
Yep.
I'm sorry.
And, I'm sorry, Ruth Ann. Also, just if you wanted to volunteer for the Druid Hill events, there's also a pretty great music lineup of performers. So, as well. Yep.
This is
All
true.
right. Sorry, Chevelle, do you have anything to add?
No, I was just piggybacking on what Wes said, and it's true that at the AFRAM they're going to have a wonderful lineup of entertainers like Tony Braxton and some others that's going to be performing during that time. So if anybody would like to volunteer, please let me know. I did send information to Candace so that she can share as well with MDH, and I'll be more than happy to send it to everyone on the commission as well.
All right, just for trivia, what was Tony Braxton's famous song? The Severna Park native, Unbreak My Heart.
Don't break my heart.
It was Unbreak My Heart, I think. There you go. Anyhow, and I met Tony Braxton at the 2001 Super Bowl party hosted by Lee Steinberg, the sports agent who the Jerry Maguire film was made. And she was walking around in a Ray Lewis jersey, and I started talking to her, thought she was just another Marylander. And I said, what do you do? She said, I'm in the music business. I was like, cool, I do nonprofit work, et cetera. And somebody came up and they're like, you're an idiot. That's Tony Braxton, who had the #1 song in the nation at the time. So there you go.
Funny.
All right. And so that, I think we are good. Is there other updates or comments from commissioners or public? All right, well, we will reconvene Thursday, September 7th. MDE will be talking about compliance and enforcement in honor of Labor Day, right, coming out of that. We'll be updating on lead screening and grant program updates from Jack Daniels. I know you're all looking forward to that. The Lead Commission will be taking nominations for awards to be given during Lead Poisoning Prevention Month. And we will have a report out on the work done over the summer. In the words of Tina Turner, you're simply the best. Thank you. The meeting is concluded. Motion to close the meeting, please.
So moved.
Second, please. Second. All in favor?
Aye.
Happy
Aye.
summer.
Thank you.